So the term adverse childhood experiences comes from a 1998 landmark study by the Center for Disease Control and Kaiser Permanente in San Diego, and they looked at 10 categories of childhood adversity. So that includes physical, sexual, and emotional abuse, physical and emotional neglect, and then 5 household challenges. So that's interpartner violence, parental incarceration, parental mental illness, substance misuse, and parental mental health issues. There are a lot of ways that addressing ACEs in a primary care clinic by medical providers can be so helpful and valuable. So one is the patient-provider relationship. People really just want to be seen and heard, and they want people to know what challenges they've made it through and overcome and how they've gotten to where they are. And when you start asking about those things and have those deep, meaningful conversations, it can really enrich that patient-provider relationship. Taking it a next step, it can help really decrease blame and shame. So often as providers, when a patient isn't responding to their medications or they show up late for a clinic visit, it might be our inclination to say, what's wrong with you? Why didn't you show up on time? Why aren't you responding to the medications? But if we really think about the ACEs, we can come from a place of strength and think, wow, it's amazing that all that you've been through, you showed up today and you're here in my clinic and we get to talk and have a conversation about you and your health, which is just really powerful. Taking it to the biological level, if I see that patient with poorly controlled diabetes or asthma who's struggling with anxiety or depression, if I know that they might actually have some underlying neurologic, endocrine, immune, metabolic disruptions, it gives me another window into helping them heal. And then I can really think about strategies to help with that underlying root cause of what's happening for them. Evidence-based strategies to treat and mitigate toxic stress that include supportive relationships, sleep and interventions for improving sleep, balanced nutrition, mindfulness, experiencing nature, mental health, and physical activity. All of these have been shown to improve neurologic, endocrine, immune, metabolic functioning, which are all key characteristics of a toxic stress response. What I am most excited about for this Pathways to Resilience initiative is really that cross-sector, multidisciplinary work, breaking down all those silos. We know that trauma, that adversity, childhood adversity, stress, stressors, impact us on so many different levels. It impacts our mental health, our physical health. It impacts how we interact with each other. It impacts our school and our education and our life goals. And so it's not going to be one solution. It's not going to be one sector that figures it out and can do it alone. It really is going to take us partnering across sectors, across disciplines, and collaborating and getting all the best minds, all the best strategies, all the best work that's out there across the nation all together so that we can really work together to help people heal their toxic stress, prevent ACEs, prevent intergenerational transmission of ACEs, and then have people live long, healthy, meaningful lives. So when I think of resilience, I think of bouncing forward. I've heard that term used and I love it, because what I'm really thinking of when I think of resilience is being stronger, both mentally and physically, on a biological, physiologic level after a challenge.